My name is Rafael Galliez. I am an infectious disease professor of the medicine school from the Federal University of Rio de Janeiro and work as one of the clinical coordinators of the infectious disease ICU from the state level Infectious Disease Institute in Rio de Janeiro. It's very important to think in terms of two situations, the clinical presentation and the epidemiological context of the patients. So normally yellow fever, we have difficult finding the first cases. But when you know it's a region that you have active transmission, you have to have a low level of suspicious, considering that in regions with active transmissions of yellow fever, you must consider criteria with have a high level of sensitivity, like fever with aches, headaches, or abdominal pain. It's able to be a very broad criteria to try to find the cases when they are not in the severe form. It's important because renal dysfunctions, problems in terms of coagulation, bleeding, these are common to all those three diseases. But considering the high level of alanine transferase and aspartate transferase in terms of liver function, this is much more normal levels above 1,000 in the case of yellow fever compared to dengue fever and leptospirosis. It's very important clinical samples that are not specific for etiologic diagnosis, which you are going at least to have a liver function and a leukocyte, a complete hemogram for the patients. This is the absolutely minimal that you must have access to. And in terms of etiological elucidation, the molecular test, the PCR, is the most important tool that you have in the beginning of the infections. When we think in terms of the physiopathology of dengue fever, you have the capillary leakage as the main drive of the pathogenesis of the disease. So when you increase the capillary leakage, you have vascular extravasation and you have an intravascular depletion and the necessity and the response to a lot of volume correction and to treat this, what we call the severe form of dengue. When we are talking in terms of yellow fever, we need to see it as not just an hepatic disease, but a systemic disease with a cytokine storm in its worst stages. When you have renal dysfunction with direct viral lesions, you have the hepatic dysfunctions, you have myocardial dysfunctions, and when you get the summation of all those organs that are affected, you have a much more severe disease than dengue fever in this severe form. So it's very important to see that the pathogenics of dengue fever, its focus on its effect on the capillary circulation and the capillary leakage. So the vascular extravasation, it's the main process that what we define as severe dengue in the WHO classification. And so it's something that we can treat with volume expansion. On the other side, when we talk about severe yellow fever, we're not just talking about hepatic dysfunctions, but you have active damage being made in the hepatocytes by the virus. You have renal damage being made by the virus, the nephric system, and you have cardiac accompaniment that you have the traditional bradycardia that it's seen in yellow fever, and you have the cytokine storms, which in the severe phase, it's complementary to all these accompaniments that you have in the disease. The minimal, when we talk in terms of primary care stratification of a patient that have acute fever with headache or body pain, belly pain, it's having a liver function test and a complete blue cell count. It's both of those exams, they are the two most important ones for yellow fever in primary care. If you have more completely liver function with coagulation tests, and if you have access to gasometry to have the pH and the bicarbonate level, it's important too, the lactate and the renal function. But you can see this as an evolution in terms of the severity of the patients. The more severe the patient, more it's important to assess other organs and even use the gasometry to have acidosis evaluation. But in the beginning, even at the primary care, you need to have access to liver function and complete cell count. Yes, it's very important just to think in terms of what level of care we are talking. So we can think that our situation, normally we're talking about a primary care physician who is beginning to assess care for a patient which has acute fever, a headache, body ache, belly pain, and came to have a clinical assessment. So in terms of the most important two exams is liver function, complete hemogram for evaluation of the blood cells. And for etiological assessment, it is the PCR for yellow fever virus, that it's the most important test in terms of diagnosis in the acute phases.